All right, I'm filming right now.
Okay. So I would come in, I would knock, I would perform hand hygiene, and I would provide privacy. And I would say, my name is Presley Allen. I'm your student nurse for today. I'm going to be performing a full body head to toe assessment. Can you tell me your name and date of birth?
Abigail McCullough, 4/13/99.
And I would check her bracelet if she had one. Height, weight, and vitals were previously validated. Can you tell me where you're at?
Presley's room.
Can you tell me your name?
Abigail McCullough.
And can you tell me today's date?
November 19th, 2020.
So she's oriented ×3, and her gait was previously assessed when she walked into the room. So now I'm just gonna perform my head to toe assessment. I'm gonna start by looking at your scalp for any infestations or masses, and tell me if there's anything that's tender.
Nope.
And then I'm gonna feel your sinuses for any tenderness or pain, frontal, ethmoid, and maxillary. Anything?
Nope.
Then I'm going to assess the face for any drooping. Can you smile, frown, puff out your cheeks? Okay, cranial nerve 7 is intact. And also I would assess for taste if I had that with me. Then now I'm going to feel for her temporal pulses and make sure they're bilateral and they're both a 2+. And then I'm going to assess her eyes. So can you just look at a spot on the wall for me? And her pupils are perla. They both dilated from a 5 to a 3. And now I'm going to ask you if you could cover your one eye and make eye contact with this eye and just watch my hands for the numbers and tell me what you see.
1, 2.
Switch.
1, 2.
Okay.
I could not see that.
Okay, so cranial nerve 2 is kind of intact. Now I'm going to also use this. I'm just going to ask you to look at my pen and follow wherever it goes, but don't move your head. So if you could just follow up, to the side, down, back down, and up. Okay, perfect. And if you could just look at the wall again, and I'm going to bring this to your nose. Now you can stare and just follow it. Okay, perfect. Cranial nerves 3, 4, and 6 are intact. Now I'm going to look inside of your ears. And there's no blockages. If you could stand up for me. And we're going to do a whisper test. So if you could put a finger in one ear and repeat to me the word I whispered to you.
Dog.
Okay. Other ear.
Cat.
Okay, perfect. You can sit back down now. So with the whisper test, cranial nerve 8 is intact. And so after the ear, let me get this back out. We're going to inspect your nostrils. Just make sure there's no blockages or anything inside. Okay, perfect. Can you close one and breathe? Do one on the other side. Okay. And if we were in lab, I would have cinnamon or coffee. I would ask her to smell and identify. And that would be cranial nerve 1 is intact. So now, let me get this back out. We're going to inspect your mouth. If you could open wide, go ah. Utilize midline, stick your tongue to the side of your mouth. Can you swallow? Any trouble swallowing? Okay, so cranial nerves 9, 10, and 12 are intact. So now I would ask you to clench your jaw, open up, close. Any pain? Okay, and also if we were in lab, I would have the sharpened dull tool, and I would press it along their face and ask them to identify if it was sharp or dull, and that's cranial nerve 5 that's intact. And now I'm going to assess your trachea and its midline. And while I'm here, I'm going to check your carotid pulse. Not bilateral. And they are both strong 2+ pulses. And I'm going to ask you to shrug your shoulders against me. Okay, cranial nerve 11 is intact. And now I'm going to assess your lymph nodes. Tell me if there's any tenderness or pain. So we have preauricular, postauricular, We have parotid, tonsillar, submandibular, submental, any tenderness or anything, superficial cervical, deep cervical chain, posterior cervical, anterior cervical, and supraclavicular. So there's no tenderness or any pain while feeling any of those lymph nodes, and your thyroid gland is non-tender. Right, there's no, okay, sorry. Okay, and so could you just take your shirt off for me? We'll go ahead and assess your skin trigger. And I'll just pinch real quick. Skin trigger is less than 3 seconds. And since you're a woman, I would tell you, I would pick a day out of the month, maybe like the day your birthday falls on every month, to stand in front of a mirror without a shirt or bra on and look at your nipples and make sure they're not inverted or there's no dimpling. I would check if there's any masses that can be seen visually. I would use your 3 middle fingers and the pads to rub down to feel for any of those masses or abnormalities, anything like that that's not normal. And then if there is any, of course, I would ask you to call the doctor because that's not normal. Then I'm going to ask you to stand up. If you could just bend over towards the windows. And the vertebrae is midline and straight. Okay. You can sit back down on the bed. Thank you. And now, if she was in a hospital bed, I would raise it to 45 degrees, ask you to look to the left. And 45 degrees, you can see if there's any JVD, which none is present. Then I'm going to ask you for your arm, and I would block off the radial and ulnar arteries and clench your hand in a fist. And it's turning white, and then open up, and it's red. So blood flow is good. Okay, and now I'm going to listen to your heart. Okay, so we have the second intercostal space, the aortic, second intercostal space, pulmonic, third, herbs. I'm going to lift under your bra. Tricuspid. And mitral. Okay. Now I'm going to listen for any heart murmurs in the same spots. Aortic. Pulmonic. Herbs. Tricuspid. And mitral. Okay, and there was no heart murmurs present, so then I'm going to assess your lungs. I'm going to get to the side. We lift your arm up real quick, and you are good 1-to-2 AP ratio. So now I'd ask you to stand up, and if you could say 99 repeatedly.
99, 99, 99.
Okay, I'm going to do your back. I'm going to go in the middle of your back. If you could, again, say 99, 99.
99, 99, 99.
Okay. So now after the 99 test, I'm going to do a W in the middle of your back. Could you take a deep breath for me? Breathe out. And then I'm going to do it on the front as well. Deep breath. Okay, perfect. Now you can sit back down. Now I'm going to listen to your breath sounds. The top of the lung. Just take a few deep breaths for me and breathe regularly. You just raise your arms up for me. Take a deep breath. Okay, I'm gonna listen from the back. So if you just want to get right here so you can see. Okay, same with the back, the top of the lungs. Deep breath. Deep breath. Okay, all her lung sounds were clear. So now that I've assessed your lungs, I'm going to check your arms for equal hair distribution, any edema, none's present. I'm going to squeeze your finger for capillary refill, and it's less than 3 seconds. Now I'm going to feel your pulses bilaterally, so your radial pulse is equal and 2+ bilaterally, brachial. Is the same bilaterally, 2+. So now I'm gonna ask you to put your arms like this, and when I push down, try to push up. Okay, now push down. Okay, and then if I was in lab, y'all would pick a reflex, but I would just say triceps. So I would get like a robot arm, but turn it sideways, and I would feel for the tendon. And once I find that tendon, I would use the tool that's provided to hit, and her arm should pop up as a reflex. And now I'm going to ask you to please lay flat, either way. Thank you. I'm going to look to the side for your AP ratio, any hernias or masses, and it's a good 1-to-2 ratio. And now I'm going to listen to all 4 quadrants of the abdomen. So first, make sure I hear any bowel sounds. And bowel sounds are present in all 4 quadrants, but now I'm going to listen to the arteries in the abdomen with the bell. So we have the aortic artery. We have the renal arteries. The iliac arteries. And then the femoral would be on the inside of her thigh. And now that I've listened to the abdomen, I'm going to palpate, and as I'm pushing, tell me if there's any discomfort, tenderness, or any pain. Anything? And then I'm going to also palpate for a distended bladder. Any pain in your bladder? Okay, you can sit up now. Thank you. And now I'm just going to ask you a few questions, like, is your hair distribution even? Any abnormal discharge?
No.
When was your last period?
Right now.
Okay. If you were a guy, I would inform you to do a testicular exam once every month, just like the breast exam. Typically, after a hot shower is the best time, and you would just raise one leg up higher than the other and get your forefingers and thumb and just roll your testicle around and feel for any masses that's not supposed to be there, any swelling. You would just, if you felt any of that, you would call the doctor and report it because that's not normal. Can you tell me what color your urine is? Is it clear, yellow?
Yellow and clear.
Okay. And do you know when your last bowel movement was?
This morning.
Okay. And now I'm just going to assess the lower extremities. So for even hair distribution and any edema. And I'm going to also check, I'm going to pull this up, the pulses in your legs. So femoral is obviously in the hip region. Popliteal is behind the knee in this cave. And they're equal bilaterally, 2+. And then also I'm going to feel the top of the foot is dorsalis pedis. So, can I take this off? Okay. I would just feel for it. And then the pulse behind the foot, the tibia, pulse, and it's also strong too, and they're equal bilaterally. And then I would also test the muscles in her feet. So I would ask you to push down, push up, okay? And then also, like in lab, y'all would ask me for a reflex, and let's just say you do plantar reflex. I would get the tool that's supplied, and I would go from the bottom of the heel with the metal part around the top of the foot as like a 7, and the toes should curl, and that's your plantar reflex. And then, do you have any concerns with your skin at all?
I'm good.
Thank you.